Good morning, everyone. Thank you, AIOS and Dr. John, for this opportunity. Apps, as we all know, are a self designed program or piece of software to fulfill a particular purpose. And now you have apps which vary in function and content and are now a part of our daily life. Apps in ophthalmology include apps for medical education, practice management, journals, conferences, patient utilization, and imaging, which we have already seen. Medical education, you have lots of apps. One of the most important one is the eye handbook, which has a lot of features which allow us working in day-to-day life. And you have diagrams, consent, patient education, and testing. So you have the Amsler grid, color vision, contrast sensitivity, duochrome test, fluorescent light there. Contrast sensitivity helps you in emergency room or bedside examination. And usually we don't have any charts with us handy for this, so we can use this for the contrast sensitivity testing. Worth 4 dot test, you always do the distant one on a vision chart, but for the near one you can use this. The color vision, we all have our little black book, but sometimes the prints fade with time, and so you can use this to test your patients. There are pediatric optotypes and fixation charts. So, and we all know that kids love the devices, so you can use this. You have the laser settings at your fingertips, so you can just have a ready retina kind of thing. You have calculators like the bifocal add, amplitude accommodation, radius conversion, IOL calculators, and your SIA calculators, which directly connect to the online calculators. There are diagrams in the app so that you can explain to your patients like diplopia, glaucoma, and other symptoms which the patient would have. Ophthalmology app allows you to have disorders of the eye at your fingertips, so you can just quickly tick whichever you want and have a brief synopsis of the disorder. Draw MD allows you to explain medical conditions to the patient, so you can just sketch and do it, and you can have the patient's image on it and share the image with the patient. iTube allows you to have a variety of videos, surgical and otherwise. The glaucoma risk calculators is a useful app which allows you to consider the treatment and other guidelines for the patient. So you can just enter in the parameters and it will give you a guideline whether to treat or whether to just observe the patient. Park's three step test. This was always been a nightmare. Which eye, which muscle, what to do. So this allows you to just evaluate your patient. TLA ophthalmology. It tells you all the short terms, short forms, acronyms which are used in ophthalmology. So it is a very useful guide. Embryo is for your patients. You can just give it to your embryopic patients and ask them to do these exercises at home. And since kids are very fond of using the smartphones, they can always be relied upon to do this exercise very meticulously. You can have Snellen chart on your phone, but then you have to have adequate illumination and other settings in your phone also. There are the toric calculators, LRI calculators, surgery simulators available. You have practice management apps like the Dropbox, where you can share your documents, sheets. You have various scanners like the CAM scanner or the doc scanner, which allow you to scan your documents, and you can just have them for your pursuit later on. You can have your OCT browser on your iPhone, Telepax, Camcard, which allows you to scan your visiting cards into the phone book. Hippocrates allows you to have your medicine dosages because we tend to forget the systemic dose of medications. And Skyscape also allows you to manage your documentations. You have apps for medical journals. We have our own IJO on this now. You have the Will's Eye Manual, Atlas of Ophthalmology. Apps related to conferences are now a routine, so that allow you to plan your day, just see what is going on in which hall, and then you can just follow accordingly. For patient utilizations, you can have the patient download the app into their own smartphone and then use it and monitor it. So you have the side book which allows them to do an AMSLR and just see progression or whatever and come back to you when they have any problem. Then you have tests which allow the patient to check their astigmatism, but this then has to be reinforced and retested again. You have the Amsler grid on the phone so that the patient, your retina patients, can do a weekly monitoring and come to you whenever they find a problem. This one, Dr. Hugh, is for contrast sensitivity testing. It is a game, but then your patient can always check his or her level and report back to you. Eye drops is a very useful app. The patients are usually senior citizens living alone or just the two of them, husband and wife, with no other support. So you can always add this into their phones. So it serves as a reminder to put in the drops at the proper time. Be My Eyes is for low vision patients. It actually is an online this thing. So the patient would send out a call, and if somebody is there around, they would help that person. So they just scan their surrounding, and the person who's come online to help them would tell them what's going on around them. You have fancy this thing contact lenses and all, so you have an avatar and just check whether the lenses are suitable on your face or not. This is one important thing which is now very close to my heart, because I have a cousin who's lost his sight due to diabetic retinopathy, and he helped me search for apps and other modifications which help him in his day-to-day life and do his work also. So these are accessibility tools for the various impairments like visual or hearing or learning or cognitive. And there are guidelines, web content accessibility guidelines, which have some certain principles, like whether the system accessibility tool which has been designed is perceivable, operable, understandable, and robust or not. So you have various screen reader softwares, speech recognition softwares, special keyboards are available, and you have screen magnification devices. These are just a few videos which I've taken with my cousin. So you have this app which allows you to locate things. So the moment a person enters the room, he can just use a smartphone, scan around things, and find out where he's entering, whether there are just one or two people in the room, or the room is crowded, or whatever is going on around, he can know. Can I have the audio on this?
Mode, 3 of 6. Text, selected. Double tap to select. Lookout text mode. Retinal diseases, 3rd edition, JSPAHWA, OPBILLORE.
So similarly, it allows you to read the whole book by taking the images. You can have it on your Kindle, and that will allow you to read also.
Captures a photo and describes the scene in front of you. Double tap to activate. Describe scene. Captures a photo and
So
describes
you
the
can
scene in
take
front of you.
pictures, it will
Selected.
scan and tell you what is in your surroundings.
Kindle. Kindle. The Marriage Maker's opening book.
This
Kindle.
allows you to read
Swipe
from your
right and
Kindle
double tap
itself. You
to
can
किताब
start
बदलने
reading.
की जरूरत है
Reading.
बड़ा पोथा लगा
Double
लियो
tap for menu.
चल के रहे
Double tap and
चलते
hold to
चार पाँच
select.
right, so you can design your own app so that your patients can be in touch with you, fix appointments, give a feedback. There are issues of patient privacy, sharing information, and confidentiality. Germ carriers, they have been, cell phones are notorious for being that. How much content you can share over the social media, the app which is there, is it authenticated, validated, and whether it has an approval or not. These all are issues which we are dealing as they crop up. Thank you very much for this opportunity.